So for somebody that's lucky enough to get by step 1 and 2, taking
right.
in nitrates, they have the bacteria in their mouth. They haven't killed that. So now they have nitrite, which they're going to swallow and go into the stomach. We need an acidic environment to take the nitrite and form nitric oxide. You mentioned the antacids and how that's a problem, and I'd like you to get further into that to start, and then we'll talk about other things to do with the gut.
So, biochemically speaking, nitrite to nitrite is a 2-electron reduction, and then nitrite to nitric oxide is just 1 electron. So, as a biochemist, we count electrons. So we have to balance equations when we do this chemistry. So the pKa of nitrite, meaning the pH in which nitrite becomes protonated to generate nitric oxide, is 3.4. And that means that at pH 3.4, 50% of the nitrite that we swallow is going to generate nitric oxide gas. The lower the pH, the greater the efficiency of protonation and conversion to nitric oxide. So when we do that, again, the nitrite becomes nitric oxide. We can detect it in the lumen of the stomach. It kills bacteria, kills H. pylori, the ulcer-causing bacteria, enhances gastric mucosal blood flow. So now you've enhanced the blood flow to the stomach so you can absorb nutrients like magnesium, iron, iodine, chromium, B vitamins. So it's facilitating this fundamental physiological response to nutrient absorption. If you can't make stomach acid because you have achlorhydria for whatever reason, or you're using an antacid, now you shut down stomach acid production. You eliminate the nitric oxide benefits of swallowing your own saliva. So now you can get overgrowth of bacteria, H. pylori, you can develop gastric ulcers. You become nutrient deficient. Without sufficient stomach acid, you can't absorb iron. You become anemic. You can't absorb B vitamins. You can't absorb zinc, chromium, selenium, a lot of these trace minerals and nutrients. But more importantly, again, you shut down nitric oxide production from the disproportionation of nitrite to NO. But in 2013, 2014, there was a paper published that these antacids, specifically what's called proton pump inhibitors, things like omeprazole, pantoprazole, they actually inhibit nitric oxide being produced from the enzyme nitric oxide synthase. So these drugs, PPI specifically, are shutting down both nitric oxide production pathways, and people who take these drugs are completely devoid of nitric oxide. Now, the consequences of that are apparent. Now, in 2015, it was reported that people who have been on PPIs for 3 to 5 years had a 40% higher incidence of heart attack and stroke. Not risk of heart attack and stroke, actual heart attack and strokes. And then just last week, a report came out showing that people who have been on PPIs for 4 years had a 35% increase in dementia and Alzheimer's. So, I mean, to me, this is like the most awakening, kind of eureka moment in terms of pharmacology. These are very dangerous drugs. In fact, they were never approved by the FDA to be used chronically. The FDA approval on this years ago was for acute use for gastroesophageal reflux disease or acid reflux. Use them 3 to 5 days and then get rid of them. Never use them again unless you have another acute flare-up. But yet people are using these every day for 10, 15, 20 years. And the consequences, heart attack, stroke, Alzheimer's. Everything is on the rise. So you have to get rid of stomach acid or you have to get rid of antacids. And so that's just the nitric oxide consideration. The other problem with antacids is it prevents the breakdowns of proteins into amino acids. It's part of our normal digestion process. The human stomach is designed to make stomach acid, hydrochloric acid, to break down proteins into amino acids. Without stomach acid, you don't get breakdown of proteins. So what happens? You have undigested food particles, undigested proteins, or what we call peptides, that are emptied into the gut. They transport across the gut. You get leaky gut syndrome. Now your body sees these foreign peptides as an invader. Now you're developing antibodies against these peptides, and that's the basis for foodborne allergies. When I was a kid, we didn't have peanut allergies, milk allergies, all these allergies that kids in school today have. And I think it can be traced back to the use of antacids as a kid. Because you can't break down milk proteins into amino acids. You can't break down any proteins to amino acids. So you develop a foodborne allergy. And it's the basis for autoimmunity. These are very dangerous drugs and should never be prescribed. It should be taken off the market over the counter. The evidence is very clear.
Now that this data is becoming public, what you just talked about there, a couple different studies, do you find in the medical world doctors are hearing this and changing the way they prescribe?
It's very difficult to teach an old dog new tricks, especially physicians, right? Because a lot of them think they already know everything. So how can you teach me something new? But some are receptive. Some are very keen on keeping up with the published literature and understanding the advancement of science and the translation into clinical medicine. But here's to me, it's so obvious looking from the outside looking in, because if you look back kind of from a 50,000 foot view and just look at the observations, these class of drugs are causing heart attacks, strokes, and Alzheimer's. Okay, so that's an interesting observation, and it's association, right? But it's not causation. But now we work backwards and figure out mechanistically exactly what's causing the increased risk of heart attack, stroke, and vascular dementia and Alzheimer's. It's because it's shutting down nitric oxide production. So now we have a biologically plausible mechanism for the interesting observations on a global population perspective. And so now we know mechanistically that there is causation. You shut down stomach acid production, you shut down nitric oxide production. This causes increase in heart attack and stroke, causes decrease in blood flow to the brain. You get mild cognitive disorders, vascular dementia, Alzheimer's. You develop metabolic disease. So now what do? Number one, you have to stop. But number two, you have to restore the production of nitric oxide. And that's kind of how we're trying to integrate this, because some people, it's very difficult to get off antacids because they've been so dependent upon them for many years. So then how do we address those patients and basically mitigate the risk of them having a heart attack or stroke or developing Alzheimer's?
When you look at all the people taking these drugs, what is at the root of that? For somebody that wants to get off of them and get to the root of that issue, how do they begin?
Well, the problem with physicians today is they don't have time to seek the root cause of why the patient's presenting with certain clinical presentation, right? And so it's just easy. If you got a patient that comes to your office and says, "Hey, doc, I've got acid reflux," well, for 40 years, you've written a prescription for antacid. So it's easy. They're in and out of the office in 5 minutes. You get reimbursed for your time. And it's an economic model, but it's certainly not a viable physiological model. So what I tell people is you have to understand how the human body works. So the human body is designed to make stomach acid. And so then you got to ask yourself, chemically, how do the parietal cells convert how does it create hydrochloric acid in the lumen of the stomach? Well, that reaction is very well elucidated. You need zinc, you need sodium bicarb, you need B vitamins, and you need iodine. But yet if you can't make stomach acid because you've been on acids for a number of years, you're deficient in B vitamins, you're deficient in zinc, and you're deficient in iodine. So now when you get off these antacids, your body doesn't have what it needs for the parietal cells to make hydrochloric acid. So you're going to remain acid deficient. So I tell people you got to supplement with iodine, 12.5 milligrams a day, 15 milligrams of zinc, salt, B vitamins, and now you've given your body what it needs. It has the raw material to make hydrochloric acid in the parietal cells. Now you can make stomach acid. You can digest proteins into amino acids. You can generate nitric oxide, and your acid reflux goes away. Acid reflux is a symptom of insufficient stomach acid production. So giving a substance that further inhibits stomach acid production is counterintuitive. And I think the consequences of that over the past 40 years have been revealed. It's not the way to eliminate acid reflux, and it's causing more harm and providing zero benefit. So this takes time, right? So what I tell people acutely, and number one, I think it's a very important point. You can't just stop these drugs cold turkey, right? Because you're going to get a rebound of acid production. So what I tell people is you have to wean off. So whatever you're taking, if you've been taking on a daily basis, cut the dose in half, take half a dose for 3 or 4 days, then take that half a dose every other day for 3 or 4 days, and then you can stop those drugs. But you have to slowly wean off, titrate the dose down. And then during that process, before every meal, just take a tablespoon of apple cider vinegar. Apple cider vinegar is acetic acid, so it's going to acidify the lumen of the stomach. So if your body can't make stomach acid, we're going to deliver acid directly into the lumen of the stomach. Now you acidify that medium, you absorb nutrients, you break down proteins into amino acids, and you don't get acid reflux. It's very simple.
How do you feel about supplements like HCl and taking digestive enzymes?
Now, look, I think they're very important, and there's a place for those because, we need these enzymes, and we need to give the body what it needs to break down proteins, fats, and carbohydrates, right? And then the bacteria in our gut, use small chain amino acids and butyrate and fatty acids. So we got to feed the microbiome, but we give our body what it needs in terms of amino acids from proteins, carbohydrates, and then break down fat. So if our body's deficient in these digestive enzymes, in fact, I take digestive enzymes typically after every meal, especially when I travel because we don't always eat healthy when we're traveling. So we got to give our body all the help it can get. And then, HCl, betaine hydrochloride, I'm a big fan of those because we need to acidify the lumen of the stomach. It's the basis of all digestion and nutrient assimilation and nutrient absorption.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
For me, it's no wonder why we have the sickest population on the planet. Everything we do is disrupting nitric oxide production. If you can't make nitric oxide, you're going to develop chronic disease, cardiovascular disease, Alzheimer's, diabetes, chronic fatigue. If you use mouthwash,